Hello, let's talk about this question about USMLE Medical Ethics, about child abuse. The question stem is, you are a resident in the emergency department. An irate parent or an angry parent comes to you furiously because the social worker has been asking him about striking his child. Possible child abuse. The child is a 5-year-old boy who has been in the emergency department 4 times this year with several episodes of trauma that didn't seem related. 4 times a year, I think, is not very normal, but the trauma 4 times are not related, do not seem to relate it. Today, the child is brought in with a child complaint of slipping into a hot bathtub with a burn wound on his legs. Burn wound on his legs. The parent threatens to sue you and says, "How dare you think about me?" Think that about me means I did not abuse my child. I love my son, the parents say. What should you do? A. Give reassurance to the parents and treat the patient's injury appropriately. B. Ask risk management to evaluate the case. C. Admit the child to remove him from the possibly dangerous environment. D. Call the police. E. Ask the father yourself if there has been any abuse. F. Speak to the wife privately about possible episodes of abuse. G. Explain to the parents that the next time this happens, you will have to call Child Protective Services. H. Report the family to Child Protective Services. I. Give the parents a referral to a family therapist they can see with the child the following week. Mm-hmm. Which, which one do you like to choose? Mm-hmm. I think as a doctor, maybe you think, oh, you can call the policeman directly, but that's not true. Or maybe you think that he can do some investigation by asking the parent what's going on. Well, let's just do the analysis. So you see that although in general it is better to address issues directly with the parents and their families, this is not the case when you strongly suspected child abuse. Because you see, when you ask the parents, maybe they will deny. Certainly, you can see that the patient see that they love their kid. So reporting of child abuse is mandatory, even based on suspicion alone. In this case, if I were the doctor, I would suspect that there's a child abuse. Although it is frightening to be confrontational with the family, the caregiver is legally protected. Even if there turns out to be no abuse, as long as the report was made honestly and without malice. You do not have the authority to remove child from the custody of the parent. Only Child Protective Services or the courts can do that. The police would be appropriate for an assault happening at that exact moment, but no such assault, right? But police are not appropriate to investigate child abuse. So when you have a suspicion of the child abuse, it doesn't matter when the parent says. So that's why talking directly to the mother or father is incorrect because they will deny. They say, "I love my child." So when you suspect abuse, even if the family denies it, you must still report. So report the family to Child Protective Services. So we need to choose H. So that's all. Thank you.